Today, let's talk about plasma expanders. So, what is this plasma expanders? Before knowing this plasma expanders, let's know what is plasma. Plasma is a clear liquid substance which is present in our blood. If we are removing every blood cell from this liquid, the leftover liquid is called as plasma. The color of the plasma will be clear and it will be like straw color and watery fluids in which several types of blood cells will be suspended. Plasma consists of 90% of water, and the total amount of this plasma in our body will be then 55 percentage. Let's see the definition of this plasma expanders. The agents which will increase the molecular weight and boost the plasma volume by increasing the osmotic pressure are called as plasma expanders. So we have seen these diuretics. What is the function of diuretics? If we have more water and sodium in our body, it will do the excretion. It will excrete that sodium and water from our body. But here we need that water. So we can't drink water and that will go into blood. It won't happen, right? That's why we need plasma. So this plasma expanders, they will expand this plasma in our body. So when there is more plasma, we can expand the volume of this blood. So why do we use this plasma expanders? We use these plasma expanders for hemorrhage and shock. What is hemorrhage? We already know the hemorrhage is when there is any leak, when there is any cut in any part of the blood vessel, whether it is externally or internally, the leakage of blood from that blood vessel is called as hemorrhage. And when it comes to shock occurs due to less blood volume. So the concept of blood plasma expanders are to increase the blood volume. So that's why we will give, for shock and for hemorrhage, we will give this plasma expanders. So let's see how this ideal plasma expander should be. So if we are taking this plasma, it should be isotonic in nature, because it should not be hyper. That means it should not consist of more solutes, or it should not consist of less solutes and solvent. It should be in medium, isn't it? So it should not be hyper or hypo. It should be isotonic in nature. And next one, pharmacodynamically inert. That means it have to go into our body and it have to show its action, right? And we have to accept that plasma. So for accepting that plasma, the plasma should be very sterile in nature. It should not contain any pathogens, or it should not contain any allergic substances, isn't it? So it should be non-pyrogenic and it should be non-allergic. So when we are taking this plasma, as this doesn't contain any blood cell, there is no need to see the blood group and all. But some plasma expanders which are containing any blood cell, or if they are interfering with our blood group, then that is not a ideal plasma expander. And it should be stable and easily sterilizable, and it should be cheap. Next one, let's see the types of plasma expanders. In this, the first one is colloidal plasma substituents, and the next one is crystalloid plasma substituents. So let's see the first one, which is colloidal plasma substituents. And this colloidal plasma substituent is the very important and the best plasma substitute. So the examples of this colloidal plasma substituents are dextran, human albumin, polyvinyl pyrrolidone, and gelatin. Next, let's see crystalloid plasma substituents. This crystalloid plasma substituents examples are normal saline and dextrose solution. So first one is colloidal plasma substituents. So in this colloidal plasma substituents, these colloids are large insoluble molecules. They are better because they can be easily dissolved in our plasma, in our blood. So that is better option, and it will retain our intravascular space. That means it will retain our plasma volume very easily, and it will increases the osmotic pressure also. And this will be having this colloidal plasma substituents, they will be having longer duration of action. So we have different types like dextran, everything, but blood is the main and most important colloidal plasma substituent. So if we are giving colloidal plasma substituents, that is equal to blood, so there won't be any difference between blood and any difference between this colloidal plasma. So that's the reason they will be easily dissolved with our blood cells. So the first one is dextran. If you see the dextran is a polysaccharide in colloidal plasma substance. Let's see the first one, which is dextran. So dextran is obtained from this lactic acid bacteria. So we will take this sucrose, and we will from sucrose we will extract this lactic acid bacteria. And the species of this lactic, mainly two species of this bacteria are leuconostoc, mesenteroids, and streptococcus mutans. We will take these two bacteria from this lactic acid, we will use as a dextran. So as we are obtaining this from sucrose, dextran is nothing but it's a form of glucose. So we will and we know that we are extracting that from sucrose, isn't it? And it expands blood by osmotic effect, and it will store in liver, spleen, and other endothelial cells. It is effective for 12 to 24 hours. It will show its action from 12 to 24 hours. The available forms of this dextran is dextran 40,000 and dextran 75,000. So doses. So we have to mix this 500 ml of 6% of solution. 500 ml of 6% solution of this dextran, which is dissolved in saline, and we have to give it through IV route of administration. So for what we will use this dextran? So we will use for shock treatment. So let's see the advantages. So the advantages are, it is easily sterilized. We can sterilize it very easily as it is dextran. Um, so it is sterilized by filtration or autoclave, and in autoclave in a small lab also we can use this autoclave, and even filtration it is very easy, and it can. So after preparing this dextran, we can use this dextran till we can store this one, and we can use this till 10 years. So for one decade, without worrying about its sterilization, we can use it worry free. Okay, that's why it is very easy and very convenient and very harmless colloidal plasma substituent. That's why we will use this more. And next, let's see ADRs, which is adverse drug reactions. First one is allergic manifestations. It will cause some allergies and prolongation. So this will also prolong the bleeding time. That means for clotting, it will take more time. Next one, human albumin. So this human albumin, it is naturally obtained from, it's a plasma protein which is obtained naturally from human blood. So we will do this by blood fractionation. So let's see how the separation method is done, how we will take this blood and how we will separate human albumin from that blood. So now we are mixing blood with a normal solution, normal water. So as depending upon the density, blood is not mixing up with the solution. But if we are keeping this aside for longer time, then it will start to dissolve in this water, and it will start to separate. So how it is separating? If you see all the red blood cells, they are going and settling down because the density of this red blood cells are very high. Now, if you see, the upper part is full of albumin. So if you see here, the red blood cells have precipitated down, they have settled down, and this one is your albumin, and the remaining this one is the albumin, and up there is a ring like structure, right? That is white blood cells. So this is how we will separate albumin from blood, and its molecular weight is 60,000. So this is non-toxic and it won't be help in coagulation. It won't disturb the coagulation factors. So let's see the uses of this albumin. It is used in the treatment of shock, and let's see the advantages. It will increase serum protein level in hypoproteinemia and decreases edema. It is used to increase the serum protein level, as this albumin is a protein. It will increases the protein level in the serum to treat hypoproteinemia, means there will be less protein in the blood. So for treatment of that we will use, and not only that, it will decrease edema. So next colloidal is polyvinyl pyrrolidone, PVP. So this is a plastic material which is intoxic, and this plastic material will be soluble in water. So the molecular weight is 35,000 to 40,000, and it is less potent than dextran. But when there is no availability of this dextran, we will give this PVP, and this will store in skin, skeletal muscles, and reticular endothelial system. How it will act? This PVP, it will go and bind to various drugs and toxins. So that's why we will use in toxicology, like any poisoning. We will use in the treatment of any drug poisoning or any poisonings. We will use this drug. Then dosage, we will take this 40% of solution and dissolve in buffered physiological saline solution, and we will administer by giving IV infusions. So let's see the adverse effects. The adverse effects is it will stop production of antibodies, and it will also produce aggregation of this erythrocytes. So gelatin, we all know what is this gelatin, and we have some gelatin drinks also. This gelatin is a protein which is obtained from animal collagen, and nowadays we do have so many gelatin drinks we will be using for, mostly these are made up of bones of some animals like beef bones and all. So what is the use of this? This protein will used in, as this is a protein, this will used in cell development. So let's see the molecular weight. The molecular weight is 35,000, and it can't do any coagulations, or it won't interfere with any blood clotting or blood grouping. So let's see the adverse effects. So adverse effects are flushing, urticaria, menourticaria, and rigors. Rigors is suddenly it will increase the temperature, and if you see, it's alteration of this temperature of our body. Suddenly if you see, the person will be having high fever with chills, and if you see after few minutes, the same person will be having reduced temperature, and he will be having sweating. So this is rigors, and it will be changing of temperature time to time in the same person. And next one is bronchospasm, we already know that, and hypotension. And next one, after colloidal, you have this crystalloidal plasma substance. This crystalloidal, as the name suggests, they will be very small plasma molecules, and they are soluble in any aqueous solutions. So they are aqueous solution which consist of mineral salts, and they are water soluble molecules, as I told you. In this, the first one is normal saline. We know this normal saline, and we will be using in hospitals very frequently. So if we are using any 0.9% of sodium chloride solution, then it is called as normal saline. So why we will take this normal saline? When we have any dehydration, instead of this electrolyte, this normal saline will use to replace this retain this dehydration, and it can be used as a vehicle for administration of vasopressin agent. So if we are taking this normal saline very frequently, then it will cause us edema. Not only that, if we are taking this saline for longer period of time, you might have observed that the hand will get swollen. And next one is ADR, adverse drug reactions. So they will be having febrile due to presence of pyrogen in this normal saline. So this febrile means fever. So rising of temperature is very common for this one. So next one is dextrose solution. This dextrose solution is nothing but glucose solution. We will take 5% of this dextrose solution and we will give as a IV infusion. It is a nutrient, and it is used in renal failure, and it is also used as a vasodilator. So we can give this in treatment of shock, and used as a diluting fluid of infusions of certain antibiotics. Like, so when we are giving any antibiotics like amphotericin B or any antifungal drugs, we can't give directly. So we will mix that one into this dextrose solution and we will give as a infusion. So let's say the mechanism of action. This plasma expanders will mainly work on this principle of this osmosis. So when we are having less plasma volume in our blood vessels due to this osmotic pressure, it will take water from interstitial fluid into the blood vessel. So when it is collecting that interstitial fluid, and it is when it is collecting this interstitial fluid, then it will compensate the blood volume. So since there is replacement of this newer plasma, when there is loss of blood, the blood flow even in smaller vessels will be very easy. So this is plasma expanders. So tomorrow we will see therapy of shock. Thank you everyone.